Well, hello everyone. Welcome to Your Health in Your Hands. I am Dr. David Ajibade, and this is another show of Your Health in Your Hands, where we talk about things that matter to you, the Nigerian, the African on the African continent, and to Africans and Nigerians around the world. I hope you're staying safe. I hope you're making the right decision about social distancing, masking, and if you've gotten the vaccine, good for you. So, I want to say a little bit before I get my guest on today. You know, the thing about being in the U.S. is and I've been here for a few months, is I've just been amazed at the amount, the advances, the medical advances. You look at the hospitals, you look at the experts, you look at the specialties, you look at the subspecialties. I mean, there's a huge amount of investment in medicine and healthcare, and there's a huge amount of progress. And you can see this everywhere around the world. This has spread to the rest of the world. I mean, there are some diseases that pretty much are extinct. We've dealt with polio, we've dealt with smallpox, measles is pretty much under control. Many of these childhood illnesses that were killing kids are now pretty much under control. We're dealing with malaria, we're dealing with tuberculosis, we're dealing with AIDS. We have found the solutions to these problems. The question is, in many of these cases, it's really not a question of technology or capability. It's more a question of political will to really wipe these things out. But the solutions are there. Now, the challenge is this: with these accomplishments have come a troubling trend. And that's a trend in the area of, among other things, brain disorders. So you think about things like autism, you think about things like ADD, ADHD, Down syndrome, genetic disorders, you see an explosion of these problems. And unfortunately, the solutions aren't as forthcoming as the other conditions we just described. In fact, in the US, there are only 2 approved drugs for autism. Think about that. 1 in 50 kids, or even more than that, have autism or are going to have autism, and we only have 2 approved drugs. And the truth is, many of these drugs don't even work as well. They don't give satisfactory progress. And of course, in third world countries like Nigeria, we see these problems there as well, but we don't even have as much access to drugs. The thing with the US and other countries is that the social structures are there to take care of these kids or these adults who have these problems. We don't have such in Nigeria. So the people in the low class and middle class simply are left to fend for themselves. And when you go to talk to a healthcare professional or a pediatrician or pediatric neurologist and ask them, what can we do about these kids? Many times they just resort to pontifications. They tell you about this and tell you about that. The truth is, they really don't know what to do. And the truth is, there's really very, very little they can do from a medical perspective. And that is why we're doing what we're doing at the Brain and Body Foundation. Because yes, there are medical limitations, but the truth is that if you support your body, if you support your brain, there are some solutions that can arise. Of course, we're not expecting them to start, kids start reciting poetry like Shakespeare, but we can see some improvements, 25%, 50% improvements, if you go through a safe, speedy, and simple routes. And we've been showing this for the last 5 years under the supervision of the federal government of Nigeria and with the support of healthcare professionals like you. So for this show, we're going to be talking about ADD and ADHD, and I am so pleased to have Dr. Albert Mensah on the show today. Hello, Doc.
Doctor, how are you doing?
I am doing great. How are you?
Doing well.
Good,
Absolutely.
good. So, Dr. Mensah, you're a pediatrician and you are the CEO and founder of Mensah Medical. I'm sure some people are wondering, that name Mensah sounds eerily African, but let's know a little about you and what you're doing in the world.
Well, it should sound eerily African. We're from Ghana as our ancestry and birth. Absolutely, we're Ghanaian. We're American now by citizenship. but we are fully Ghanaian in every single other way, shape, and form. And what it does is it gives us a very interesting perspective of blending both worlds when it comes to treatment and healing on the African continent. It is a lot more, how would I put it, a lot more sincere and in-depth to help treat people from the continent with a background in the continent, bringing into the system paradigms from all over the world, as we've been exposed to and work with, than it is for someone who doesn't understand what a typical Nigerian or Ghanaian meal looks like. And so how do you navigate the waters of diet when you're looking to correct things like ADHD, autism, and so forth? And all those things are treatable. Don't let anyone on this planet tell you they're not treatable. It's treatable because we do it. And we've trained others around the world to do that. Just last week, we had a child who lost their diagnosis. The psychiatrist, the school psychologist, and a social worker reviewed this child's parameters, behavior, and capacity in school, and said this child no longer qualifies for the diagnosis of autism.
Really?
It is more treatable. This is not one unique case. This is among several cases. So this is what we're talking about, undoing paradigms that don't really exist. It's called certain specialties are not aware the treatment is possible. And the treatment doesn't come in a pill. It comes in a process. And that's what we're here to talk about. So with regard to ADHD, absolutely, I'm what we call a family practice physician, which incorporates very prominent skills in pediatrics. And so working with children is something that we do, and that's where Dr. David and I come in.
Absolutely. Absolutely. And before we really delve into ADD and ADHD, I was going to ask you, I mean, if you really are African, how many times a week do you eat things like fufu, for instance?
Well, here's the funny part. Fufu is not on my favorite list, but everything else tends to be. So we can certainly sit down at the table and enjoy still quite a bit. But in my family, for some reason, me and my brother, we never really enjoyed fufu even growing up. But everything from all the different soups and stews and all the rice dishes and so forth is still a very big factor, of course. But it gives us extreme insight into what those meals and those foods actually do to our gastrointestinal system. And that, Dr. is one of the things we're going to talk about when we reference ADHD, because the very elements that seed fungus and yeast in our gastrointestinal system, in our bowels, in our stomach, can now lead to toxins that can cause focus and attention issues in children. So the more we eat our fufu, our banku, our etsu, our stews that are rooted in carbohydrates, starches, the more we plant seed for poor focus and attention. And that is one of the critical 4 pieces that are often part of the diagnosis or lead to the diagnosis of ADHD.
Fantastic. We're going to take a short break very soon, Doc, but I wanted to say this. As I've studied this and I've worked with this over the years, I remember when we were in medical school and we would hear things about autism and ADD, ADHD, and that was just the time for snoozing in class, because we all knew we weren't going to have any kids, probably 1 or 2 in our lifetime as medical professionals, where we'd have a child with autism. We knew, first of all, we knew it wasn't going to come to Nigeria, and secondly, it was a white person's disease. That's what we all thought it was. But now, as I'm studying this and as I'm working with this at the Brain and Body Foundation Nigeria and looking at the research, it seems more and more clear that people of African origin, especially those who live in the Western world, and probably there are reasons for that, have greater risk of having these conditions than white people themselves. And you can correct me about this, but some of the things that we're finding out, like vitamin D deficiency in the pregnant mother, for instance, which predisposes them to having a dysregulation of their immune system, the pregnant mothers, which can cause some kind of dysregulation in the development of the fetal brain, can predispose to things like autism, ADD, and ADHD. And
One of the
let's get back with that. Let's get back after this short break, Doc, so that we can talk about that in detail.
absolutely.
We'll be right back. Okay. All right, Yhiyh, please delete where I talked about the pregnancy and vitamin D and all that. Just scrap that all out. So I'm going to start the next segment now. Welcome back. We are, Dr. Mensah and myself, are talking about ADD and ADHD. And Doc, I think we need to start with a definition. Help us to understand what ADD, ADHD actually mean.
Okay. Well, there's the traditional sense, and then I'm going to shake some things up a little bit. Traditionally, we're talking about attention deficit disorder, ADD, or attention deficit hyperactive disorder, where the kids not only don't focus, but they're extremely movement oriented. Okay.
Yeah.
And again, to me, this is what I call the silliness of medicine in our own ignorance. Because we don't know exactly what's causing it, we just describe it. There's a problem with attention, there's a problem with hyperactivity, and we call it a syndrome. Why don't we get to the core problem to begin with? First of all, let's make it very simple. These are focus and attention syndromes. When I began doing some work on presenting a case one day, I began to think about my seminar series. And as I looked at ADHD and I started looking at the underlying causes, there were 4. And I said, well, obviously, if these are the 4 causes, then this disorder is not attention deficit. It is either undermethylation, overmethylation, copper toxicity, or yeast toxicity. And these are the causes. Therefore, those should be the names that we use to address the imbalance. Now, we don't know that aside from testing. But then I realized, well, what do they all have in common? Focus and attention. So now I look at, Dr. David, FAS, focus and attention syndromes. I don't call them ADHD anymore, because ADD is a psychiatric diagnosis. When we look at psychiatry and psychology, they begin where medicine ends. In other words, if you've tried everything in medicine and you don't have a cause, now it becomes psychiatric. Now it becomes psychological. Okay. That's by definition. Doc, is this what we were taught in school? Okay. Well, that's not the case here, because we know that with ADD and ADHD, quite actually, there are underlying causes that are testable. So many of the individuals, most of the children who have ADHD are undermethylated. They don't have enough of these methyl molecules, which are activation groups. They activate or turn on our enzymes, hormones, neurotransmitters, and even the DNA that allows us to move and to function in the first place. A smaller segment are actually overmethylated. They have a tremendous amount of these activating elements, and that causes the brains to literally just spin faster and faster in process. And so it looks as though these kids aren't paying attention, but then when you ask them questions, they know the answer. But they may be all over the classroom, okay? And this is the sad part, because these children are being placed inappropriately into categories of behavior disordered children, or children that are causing trouble. Well, it doesn't work quite so simply, and it's inappropriate thinking.
I want to jump in here, Doc, and paint a clearer picture for us, if you will, on what ADD, ADHD looks like. And I know you've given a different definition, but for those parents who are not sure what their kid have, and obviously they need to be properly assessed, but just if you can just give us a general picture.
Sure. Your children who are, first of all, performing very poorly in school. And when you talk to the administrator or the teacher, they say, well, this child can't sit down or focus. Their attention is everywhere, all over the room. They're constantly staring into space. They are causing trouble with other children next to them. They're diverting other children's attention. They're not being able to focus or sit down. And so the question of, their grades are poor subsequently. The grades are poor.
Are they noisemakers in class?
They can be. They can be noisemakers. They can be the ones who pretend to be funny. They're distractors, usually. That's what gets them into trouble, the fact that they're distracting other children.
Okay.
So these individuals, as they do traditionally, I'm going to skip ahead for a moment, when they're put on medication, they tend to do better. Their grades come up, their performance does better, and so forth and so forth. But it's based upon this diagnosis that they're using these pharmacotherapies in order to treat or correct. And it doesn't correct anything. It only masks the symptoms. And then later on in the day, when the medicine wears off, the child is back to doing what they typically do.
And they need
Now,
more and more.
AD, correct. ADD has the attention problem, but not the hyperactive physical movement aspect to it.
Yeah.
It's still an issue of focus and attention, but not with hyperactivity. Now, what we now understand is that typically people who have ADHD, again, are what we call undermethylated. They're low in these control molecules. Those with ADD actually are overmethylated. They have way too many of these activating molecules in their system. And the treatment is diametrically opposed. Diametrically opposed.
Wow.
The other piece.
But traditionally, are they treated the same way, standard medicine?
They are in traditional medicine, yes, because of the diagnosis, the label of ADHD. They're all given the same meds. But then you know about those people, doctor, who many kids don't respond to those psychiatric meds.
Right.
Well, if they're so correct about the diagnosis, why don't they respond? People say bioindividuality. You say, yes, that may be true. But what underlies the bioindividuality is that the underlying causes are actually different. And that's why many children don't respond to those medications, despite the label. Okay. And moving to the next level, which is actually uncovering the root cause of those focus and attention problems, that's what gets you to proper treatment, improvement, and correction. Okay. Then we have other things like certain metal toxicities, like copper. Excess in copper can cause ADHD type symptoms. And then yeast in the GI tract, where we started before in our earlier segment. All this wonderful food that we enjoy standardly as Africans, West Africans, it's not always the best for our children, believe it or not. It may be traditional, but maybe this is why some of our children are susceptible to some of the challenges that they are. Now, maybe, Dr. David, now that we combine folic acid with elements that create yeast, that may be too overwhelming for the system. And maybe while we're seeing now more ADHD than we did when you and I were children, or you and I were even in medical school, we've changed the world artificially. So now even what has been traditional and tolerable by our systems, when we now add these synthetic agents or excesses like folic acid, it becomes overwhelming for our systems, and things like ADHD arise.
So, Doc, if I'm listening to you for the first time, I could leave with the impression that, and I'm sure you clarify this, that folic acid is what's causing the explosion in ADD and ADHD. Is that what you're saying?
Folic acid, yes, we believe to be a major cause for those individuals who are what we call undermethylated. But most of the children who have ADHD are undermethylated. Now, let's say you want to turn on the light switches in your house, or you want to run machinery in your house, in your home. Okay. Each machinery has a light switch that you turn on and turn off to regulate that device. So let's say you have 10 devices in a house. But what if you only had 3 switches for all those devices? And so you're missing 7. It means your gas stove can't work part of the time. It means that your refrigerator doesn't work most of the time. It means the lights above you don't work because you don't have enough switches to control all those systems every day. Now, your system is like that. For every fraction of a second, there are millions of reactions that occur that involve needing those switches. What if you only have 1 or 2 million? when you need 25 million in a fraction of a second? Well, that's a big number to try to keep in your mind. But let's just say you just don't have enough. And if you don't have enough, your system doesn't work very well. And now that's just 1 second. What about 24 hours in a day? You're operating at a deficit of capacity, 24 hours a day. Let me give you a simple example. It's a tragic one, but we talk about hunger and homelessness, hunger in the African continent, hunger all over the world. Why is that? Because you don't have enough food. What does the human body look like when it doesn't have enough food ongoing? It looks sick. Well, the same when you don't have enough of these control mechanisms, these macromolecules inside your body. Without them, your behavior is ill. You cannot focus. You cannot do what you need to do to really not only survive, but thrive mentally. Your grades are low. Your behavior is erratic. That is functionally a sickness. But it's a sickness because of a lack of the proper balance in these control mechanisms, for the most part. Okay? So
Doc, we're
that's
going
what
to have to take a short break at this point. But please don't go away, folks. We're going to clear everything up. Some of you may be a little confused about methylation and all that. We will help to hopefully clear it up when we're back. Don't go away. Hey, Yhiyh, so we're going to scrap this second segment, scrap it out completely. We're going to start the second segment again. So this is going to go for another 8 minutes. So 2:54 now. And then we're going to end by 6, that's 3:02. Okay, so Yhiyh, you got it, right? So just scrap it all up. We're going to start again the second segment. All right. Hello, folks. We are back, and I'm here with Dr. Mensah, who is the CEO and medical director, Doc?
is CEO, no, the medical director is Dr. Bowman. I'm president and CEO of Mensah Medical.
President and CEO, and you treat brain disorders, including autism, ADD, ADHD. What am I missing?
Anything you can imagine that has to do with the brain: schizophrenia, bipolar, anxiety, depression disorders, a variety of conditions. We don't treat migraine headaches, though. We don't do headaches.
That's more of a neurological condition, isn't it?
Correct.
Yeah. Wow, that is schizophrenia. I mean, I would say that is probably what's the word now? So, Doc, when you talk about schizophrenia, in my mind, I'm thinking that's the holy grail of psychiatry. I mean, if you can treat schizophrenia, that's saying a lot. But I guess that's going to be a discussion for another time. All right, let's get back to ADD, ADHD. Tell us give us a succinct definition. What is it, and what do parents see, or what should parents look up to know when a child has ADD or ADHD? And before we go back into how it comes arise, or what you think are the causes from your studies and research.
Typically, parents see poor focus. Well, they see an inability of a child to focus on tasks, to complete tasks, whether it's at school or at home. You ask them to do 3 or 4 things, and they may do one, they may not finish that task. And typically what you see in school is the same conversation by the teachers, which is that your child is not performing, they're distracted, they're distracting other children, they are not doing what they should be doing. And many times it's thought that these children are just naughty children or misbehaving children. But over time, many teachers will come to say this child may have attention deficit or they're hyperactive. And so the terms ADHD come into play, or ADD come into play.
I see. Okay. So it has a lot to do with focus. Is there a lot of noise making? Are they unruly? Do they affect the rest of the class?
They can be unruly. They can affect the rest of the class. Or they may just simply look as though they're staring into outer space and not paying attention whatsoever.
Okay. Right. Is there a demographic? Is it more among the more affluent or the less affluent?
No, that one has no demographic truly. It is not affected by race, color, financial situation, economics, none of the above.
Got it. Got it. All right. So take us back into what you believe are the causes and how this thing comes up, why there's so much of it these days.
Really, what we consider these focus and attention issues are due to a strong contribution from what we believe to be too long a use of folic acid in pregnancy. Folic acid is really necessary for the first trimester of pregnancy. So please understand, we're not saying don't use folic acid. That would be a big mistake. You need folic acid to make sure that what we call neural tube defects don't happen. That's a problem where the brain doesn't develop properly. You need to do that for at least the first trimester. So you take your folic acid when you're getting pregnant or looking to get pregnant, and then you take it throughout the first trimester of pregnancy. So you know for sure you're pregnant, take it for an additional 3 to 4 months, and then you're good. The problem is when you take it far longer than that, that can actually be one of the factors that can predispose your child to having ADHD.
That is interesting. That is really, really interesting. And you have data and research for this, Doc?
Oh, absolutely. Absolutely. We see a very strong correlation. If you can even do this one yourself, you look at the rate of increase of ADHD and autism for that matter, and the timing of when we started suggesting that our mothers, pregnant mothers, take folic acid beyond the first trimester. You'll see the slopes matching up perfectly in the research. See the slopes perfectly, perfect increased correlation between the two. And we also know empirically that most of the children who have ADHD are what we call under-methylated. Methyl molecules being regulating switches, if you will, and there are not enough of them. And folic acid actually removes more of these switches from your system and the level of DNA. Okay, that's where it counts. And that's what excessive folic acid does. And we see that all these children are low in these switches. So we can draw 50,000 different correlations, but the fact is they're coming up with the same points. Folic acid is key, timing is key, and excess usage is key, along with genetic predisposition.
So you're saying that, and I know there are other causes for ADHD, but you're saying that even given the right doses after the first trimester, not even overdose, even given the right prescribed doses by the doctor, can result in a higher risk for ADHD?
Absolutely. Absolutely.
That's fascinating. Okay, well, what we're going to do, Doc, is we'll try and get some of this research and information. If any that you can spare, we'll put it on our website. So if people want to get more information, they can go to it, if you don't mind. So just in case they want to know about it. Okay, sure. So thank you. Other than folic acid, what are the other things that you've seen?
You know, quite often in children, this is not a pregnancy issue. This is after pregnancy. But many children who are high in copper levels can actually exhibit focus and attention challenges because copper is a neural stimulant. It is truly one that affects nerve cells as a great conductor of electricity. Anyone who works with mechanics and electronics knows copper conducts electricity well. But the human brain is an electrical and a chemical organ. And so those same rules apply. High levels of copper can cause nerves to discharge in the brain very rapidly and in an uncoordinated fashion. Now, that is what leads to the poor focus and attention because your brain is constantly being distracted by something else as the nerves are firing in the mind, in the brain.
What's causing the high levels of copper in these kids?
For many children, it's actually an inability, especially females, it's an inability to process that copper. But that genetic challenge can also come from a mother given to a son. So that's what, but boys are not designed to handle copper, girls are. And the reason why is because copper is part of the process of developing blood vessels, by which ultimately one will need to develop blood vessels for a developing baby that a female will carry. Males don't carry babies, so the male system is not quite so used to having higher copper.
At least not yet, Doc, not yet.
Not naturally, put it that way.
There's a lot of things are happening in your country over there over here in the U.S. It's kind of
and they're crazy, and they're very problematic as well. Not going to happen. So.
Okay. So copper, so there's a genetic deficit in the metabolism of copper.
Yes.
That makes them.
And even diet. So high carbohydrate diets, high starch diets can predispose individuals to develop yeast in the gastrointestinal system. Yeast in your intestines can literally produce toxins that go to the brain that now cause poor focus and attention.
Okay, tell us about that, because that's of particular interest to us in Africa, obviously. So yeah, let's hear some more about that, Doc.
Well, let's look at some of our foods that we eat. So Doc, we talked about fufu at the beginning, okay? Mm-hmm. In Ghana, we have etso and banku. All these things are starch-based potatoes, French fries in the modern times, so-called bread. Oh, I always say the best bread on the planet is in Ghana. I'm so sorry to tell you this, but
you can have the bread. We can have the jollof rice. So you're good.
Thank you. You can keep the jollof rice. Very well known to both our cultures. But these starches, even the jollof, can produce yeast in our GI tract. Yeast feed off of carbohydrates. And so as they grow, they produce toxins. They produce what is called a leaky gut. And when the gut is no longer tight and begins to leak, now toxins flow from one area to another area into the bloodstream and create inflammation in the brain. Also, when you have the leaky gut, even feces, small amounts can get into the blood system, which is toxic. And that's what leads to the poor focus and poor attention. Now, this leaky gut can be healed, but I just wanted to show you that when you have yeast, they create inflammation. That inflammation and the toxic elements, they get into the bloodstream, now affect the brain's capacity to process. And that is yet another reason for a poor focus and attention. So diet can play a very major role.
It's gonna be hard. It's gonna be a hard sell to get people to stop taking fufu. I can tell you that for one, Doc. And that's a losing battle right there. So what can we do about it other than stop eating pounded yam, fufu, and jollof rice? What can we do if there are kids with this problem?
Well, here's the difficulty. So moving against these kind of cultural norms is extremely difficult. Now, when we talk about ADHD in particular, what we're really saying is, look, we have to change some things. We're not talking about everyone. This is not something that's mandatory for everyone. Just those individuals who have all these predisposing factors. And yes, unfortunately, now we have to get rid of the bread. We have to get rid of the fufu. We have to deal with vegetables and meat. Vegetables and meat. You can cook the vegetables however you like, with whatever seasons you like. But breading and starches have got to be removed. Okay. If you have serious cases of these conditions, this is where it's culturally very difficult. I don't know a country on the entire African continent that doesn't have rice as a staple. It doesn't have some starch as a staple. Okay. But these are the conditions that we're looking at now. So for that one individual, that one child, this is part of the process. Okay. There are other things that can be done, but if you're talking about yeast as the primary cause, then it has to be corrected. If you're talking about something else as the primary cause, then the diet is not so much an issue. Okay. For example, high levels of copper, as we mentioned. When that's an issue, diet is not involved.
So then what can be done? Because forget it, Doc. They're not going to stop eating bread. And remember this whole story about the guy on the ledge and it's like, help, I'm going to die. And then someone speaks from above and says, hey, I'm God. Trust me, believe in me. And then come on, just let go. And the guy says, you know what the guy says, is there anybody else out there who can help me?
Yes, right. So
it's a lost cause. What can we? Is there anything that we can do on this?
Now I'm going to give you a couple of things that you can do actively without changing your life. Okay, and because if you don't have direct testing, it's harder to say with what certainty these things will help. But tyrosine is a nutrient that you can take. For children, usually about 250 milligrams of tyrosine in the morning can improve focus and attention, especially in undermethylated people.
That's an amino acid, isn't it?
Correct.
Okay.
I want you to remember the adage, for every drug that's out there, there's a natural agent that can do the same thing. That's what for adults, 500 milligrams of tyrosine.
Okay.
Now, there's another one. Here, I'm just going to give you the initials, DM, as in Mary, AE. 100 milligrams per day in the morning for children. So if the tyrosine doesn't work, you can try DMAE.
Okay. Thank you. That helps. That 100 milligrams, is that for both adults and children?
That one is for children. For adults, 200 to 300 milligrams.
300. And that can go some ways towards settling the child down.
That's for focus and attention.
Focus and attention, got it.
That's different than behavior. If you have an erratic child, we recommend inositol or Gabamax. That's more for calming anxious children, not for focus and attention.
So tell us about that again. Are you comfortable telling us the Gabamax?
Gabamax, GABAMAX, is a good one for calming children who seem anxious. And you give them about 1/3 of a teaspoon. It's a powder. 1/3 of a teaspoon twice a day.
Sorry about the noise out there, folks. Can you say that again, Doc?
Gabamax, 1/3 of a teaspoon twice a day. It's a powder.
Powder, okay.
Now here's one if you want to order from Amazon called Gabatrol. That one can actually help with focus, attention, and calming of an anxious child. And you take it as Gabatrol, Gabatrol. It's on Amazon.
Fantastic. Fantastic. Folks, these are not medication. You would not be prescribed medication over the online. These are simple supplements that you can use to help your kids. And there's a very wide safety margin, right, Doc?
Absolutely. These are absolutely benign. These are not drugs, so there are no side effects.
Right. But so we have about 4. All right, so Doc, thank you so much for all this advice. And by the way, folks, Dr. Mensah, for those of you in the US or around or have access to the US, he does, his clinic does consultations, virtual consultations, and very soon with the vaccines going out, your doors will be opening up, right? So you can actually start scheduling actual visits, right? For proper assessment and treatment of cases, so.
Correct.
And it is Mensah Medical? Website
it
address?
is Mensah Medical in Warrenville, Illinois. You can reach us at www.mensahmedical.com. For those of you, pardon?
Mensahmedical.com. For those of us?
Correct. I was going to say, those of you who are sleeping on the African continent and don't know how to spell Mensah, it's MENSAH.
No Nigerian should ever say they don't know how to spell Mensah, because we had a lot of Mensahs teaching us as teachers back in the day. So we had a lot of Mensahs. Even I had a Mensah teacher. The person who taught me how to drive was Mr. Mensah. So I know it. Doc, thank you so much. Any final thoughts?
I don't want people to be discouraged. There's hope. Whatever it is you're looking for, there's hope. And don't let someone tell you it can't be done. We're doing it all the time. So search, keep looking. Call Dr. David if you have any questions. And then he knows how to get a hold of us as well. Okay. Thank you, Dr.
Absolutely.
David. We appreciate the
Absolutely. Thank you so
opportunity
much.
always.
Thank you so much, Doc. God bless. Appreciate it. We'll talk later.
Thank you.
Folks, thanks for joining us, and we will see you next week. Remember to stay safe. God bless.